Cancer is a situation where a community of cells in our bodies gets out of control. To understand that, you really have to go back and think about what we're made of. We're made up of trillions of cells, and they grow and in an orderly way. They turn over. If you go way, way back to the beginning, to the embryo, there's multiplication of cells to make up all of our organs. The cells all have their instructions from DNA, their deoxyribonucleic acid, which has the messages of what they're supposed to do. And they follow their instructions, and they orderly unfold to make organs, to make your liver, your kidney, your brain, and eventually an adult human being. And even then, our cells are constantly turning over, but it's all under precise control. But under certain influences, some groups of cells in our body may start to grow out of control. They just start to grow in a kind of helter-skelter crazy way, and they start making a tumor.
A tumor simply means an abnormal growth, and a tumor can either be benign or malignant depending on the type of growth and the type of cell that it is. And so you might be diagnosed with a tumor and you can be just fine if you have it taken out, or you might be diagnosed with a tumor and then have to undergo certain therapies because it is actual cancer.
Cancer develops because it acquires those DNA mutations, and the mutations can occur because of viruses, as in cervical cancer. We know most of them are caused by the HPV virus. Skin cancers are usually from sun damage. Other cancers from chemicals in our environment or work-related. So it depends on the alteration of the DNA. So every tumor has a different type of mutation or alteration.
So there are cells that cover or line hollow spaces, and we call those epithelial cells. When those cells become malignant, they become what we call carcinoma. And that's the most common type of malignancy that people are most familiar with: breast cancers, prostate cancers. Those are all carcinomas. Then there are cells of the connective tissues, of the stuff in between those cells. And those are called mesenchymal tumors, which are sarcomas. Then you have what some people call the liquid tumors or the blood tumors, the leukemias and lymphomas. Those are a little bit different because they're a different kind of cell. There's cells of the bone marrows or cells that make up lymph nodes. And then finally, there's kind of a tumor that's kind of a category all to itself, which is the malignant skin cancer known as melanoma. It's a very different kind of cell, a cell that can be found anywhere and can spread and have unusual appearances. So we just kind of give that tumor its own category unto itself.
As the tumor spreads, it'll invade little blood vessels and then spread through the bloodstream to other parts of the body, or it can get into lymphatic channels, which are another kind of vascular system within the body that deals with the excess fluid. Even if a few cells have spread on a microscopic way, to different parts of the body, if there are only a few of them, chemotherapy might be able to wipe out all of them, and then the patient will do very, very well.
Wireless appearance, hyperchromasia.
Early detection is one of the most pivotal portions in strategizing treatments that we know of. And you're less likely to die from a cancer the earlier you detect it.
So some tumors have a pre-malignant stage. So they're still in the same place. They haven't infiltrated tissues, but they take on certain cellular changes that we can detect and say, okay, we need to look more carefully and try to help take out whatever pre-malignant tissue is present before it becomes malignant. So in those particular tumors, and that's especially true for tumors of the cervix, prostate, and colon, we can actually screen for them.
A cytotechnologist is a professional who's trained in the morphology of cells to detect precancerous lesions and cancer cells. And the basis of their training is an ability to pick out isolated cells out of numerous normal cells in a process called screening.
Having those cytotechnologists there that are doing this every day is a great tool You know, I go down there, they're incredibly helpful, they get the slides prepared, and then I'm able to just look at it under the scope and hopefully facilitate the clinician in a diagnosis right there.
Military cytotechnology is extremely relevant. I think that it is nearly impossible for the pathologist to do their job without a strong cytotechnologist. And I think it's really important to have a continued strong cytotechnology program for the DoD to continue on that mission for sustaining the force and for early cancer detection.